Welcome to the DSO Hygienist Podcast. This podcast is for everyone in the DSO space. Whether you're a hygienist, dentist, assistant, or leader, we're here to bring you expert insights, real-world strategies, and conversations to help you thrive. I'm your host, Christine Dio, and together we'll explore how to elevate patient care, grow professionally, and navigate the ever-evolving world of DSOs. Let's get started. Danielle Avila, BSDH RDH, and Laura Betancourt, BSDH RDH, bring over 30 years of clinical experience in the New England area to their roles as co-founders of LD Coaching. With a passion for fostering meaningful human connection, building strong relationships, and empowering individuals to advance their careers, Danielle and Laura are dedicated to helping their clients gain the confidence and clarity they need to succeed. Both are avid learners, committed to continuous education, mentorship, and promoting a positive growth-oriented attitude in all aspects of life. To connect with them, email hello@LDIAMANTE coaching.com. Welcome. I'd like to welcome Danielle and Laura from LD Coaching to the show today. Thanks so much for coming on, ladies.
Thank you so much for having us, Christine. We're so excited to be here.
Yes, thank you so much. This is going to be incredible.
I am very excited too, because today we're going to be talking about patient communication. And I think there's so much more to learn and to develop your skills when you're communicating with patients. I know myself, sometimes I get stumped or stumble, and I really like a little bit more flow. So I'm excited because I know you're going to have some good information for us today. So let's just get right into the questions. So can you discuss the importance of using clear and accurate periodontal verbiage when communicating with your patients?
Yes, I love this question. So I think that when you're using, accurate yet patient-friendly language, it really just helps to build trust and clarity with our patients. It's also really important that as a team, we're aligned in our terminology as well. That just is going to in turn help us to understand each other better and just really does truly provide that seriousness around the periodontal disease that the patient is experiencing and their condition. And I think that when we can be, again, more clear and concise, the patients are more apt to accept the treatment recommendations that we're making for them in the chair that day.
Yeah. So, what role does effective communication play when you want to increase patient compliance with the periodontal treatment?
I, again, love this question. So, effective communication just really connects with the why behind the treatment to what the patient truly values. Whether that's the patient building their confidence, helping them with the longevity of their life, or just overall wellness, it's so important to be able to connect to their why. And we want to be clear and empathetic with our messaging so we can get the patients to truly have that buy-in and to have that long-term compliance. It's so important.
Right, because the follow-up is so important when you're dealing with periodontal disease. So, what are some
Absolutely.
key pieces of advice for hygienists to help them feel more confident when discussing periodontal conditions and treatments with their patients?
Great question. So I think that it's really important as providers that we're educated and have knowledge in what we're speaking on. So that clear phrasing, even giving stats, I think is really important. So if we have any clinical data or, those stats of that linkage of the oral systemic for that patient, I
Mhm.
think when we're able to do that, we're really connecting with that patient and we're giving them the authority and the autonomy to make that decision for them because we're speaking from a place of love and we're advocating for them to get them truly healthy.
Yeah. So, could you discuss the importance of individual care plans and how do we tailor that approach to the different patient needs? especially with diverse age groups or other different risk factors?
Absolutely. So I always love to talk to hygienists about how every patient is different. You know how many of us, and I mean, honestly, I used to be this hygienist where I would think I'm doing the same thing over again. It's like on that hamster wheel. But in actuality, every patient is so unique and every hour is going to be completely different because we want to assess the lifestyle of the patient. We want to really dive into their medical history and their own unique risk factors to create a specific unique care plan that is realistic and personalized for each individual that we're seeing. And that is going to help drive better outcomes and, quite honestly, stronger patient relationships across all demographics.
Yeah, a medical history is so important now that we know there's so many different risk factors that play into periodontal disease. So,
Absolutely.
what role does patient education play in your practice, and how do you ensure that patients fully understand their oral health status and treatment options?
Love it. Yeah. So I think for us, education at the forefront of everything is truly the most important piece. When we're able to sit our patients up and maybe we're utilizing a voice technology, perio charting, and we can show them the visualization of where they were and where they're at, you know, aids like that or any aids that patients may know that you use in your op that have like the periodontal levels, like, healthy bone, healthy tissue, the, gingivitis tissue and bone, and then showing them the actual periodontal bone and tissue.
Even AI right now.
AI absolutely is truly incredible as well. I think that all of those things and together as one are really important to educate our patients on, health versus disease and really aiding to getting them towards that healthy spectrum.
Yeah, I love that. And I definitely think, depending, like you said, the individualization of patient care, some people are visual, some people need more information. I think too, you have to cater your educational approach to your patient as well.
Oh, I totally agree with that.
So, how do you assess the patient's overall oral health during your routine checkups, and what key factors do you prioritize in your evaluation?
Assessments are key. This is why that beginning portion of your appointment is so imperative. We can't just quickly skip over that and, get to the nitty-gritty. Like we have to take time to perform a comprehensive perio chart, to take those radiographs, to talk about salivary diagnostics, to do our intraoral examinations, our TMJ muscle examinations, our oral cancer screenings. All of this plays a role in developing that individualized care plan, that strong health history, connecting the dots. And if we can truly prevent, like, we're prevention specialists here, like, let's truly prevent disease from happening. It's a game changer, and that is like bringing the whole picture together for our patient. Like we need to be putting that puzzle piece together for them.
I think that's so true, so true. So how do you handle, because I know a lot of people want to know this, how do you handle cases where a patient might resist your recommended preventative treatment, such as fluoride or sealants or perio, and how do you overcome those objections?
This is so funny. I think Laura has a really great story. I'll answer what we do, and then Laura will give you a little story from yesterday. But I think it comes down to really truly listening to our patients first and what their goals are. And I think a little bit of motivational interviewing along the way goes a long way to really
Mhm.
understand where that hesitation comes from. Not only asking them the yes and no questions, but maybe asking them, what about fluoride? What is it about the fluoride? Is it the price? Is it the fluoride itself? Giving them options, maybe a nanohydroxyapatite option for them, and then truly educating them. Again, it comes back to that educational piece around their patient's goals. How important is it for you to keep your teeth? and then really just relaying back all of the things that we've assessed and found in that appointment to the why, and educating our patients on why they need this service. But again, I'll let Laura share a story from yesterday about a patient, because we deal with this a lot in clinic and on the day to day.
Yeah, so I had one of those patients, my last patient of the day yesterday, that it was a challenging time, to say the least. He immediately said that he hated coming to the dentist. I don't like being here. And we were implementing a new way of cleaning his oral cavity. He was going to be experiencing GBT, guided biofilm therapy, for the first time. So it's a whole new protocol. And immediately he shut down. He did not like anything new. He wasn't open to my questionings, or the disclosing, or the they immediately told me that he doesn't like water. I told him that it was warm water, that, so I was immediately being hit with resistance, and I just had to pursue and continue on. And for me, what I think worked and ended up being a successful appointment is I was able to relate to him and find that one thing where he was like, "Oh, how did you know this?" So I did review his medical history, and he was on taking some high blood pressure medications, and then he said that was all that he was taking. Well, upon all of my assessments, I found that he had very acidic bacteria, and he was presenting with a lot of erosion. So I asked him if he had ever experienced acid reflux, or was he taking any acid reflux medication. And he kind of just stopped, and like, this is probably halfway through our appointment. And he kind of stopped and was like, "How did you know that?" And it was within that conversation where I could see the turnaround. And he was more open. It still took time, and there was still a lot of back and forth. But after that, he was like, "Okay, you know what? I can tell that you are understanding. I can tell that you're trying. I know that I'm difficult. Let's work together." And I mean, I know Danielle was kind of listening to the whole thing and supporting me from the other room. What else do you think was like a really good takeaway from that patient in that moment?
No, I think, like you said, the patient saw the value that you were providing in that moment, and understood that you were just more than a tooth scraper,
Mm.
and made that connection that you saw something that nobody else has ever mentioned before. And yeah, he does see on the news, and that there is a link between the oral cavity and the systemic health. And you're right, I do need to do better. And so I think within that conversation, something just triggered him to understand and realize that, you know, we're more than just, again, that tooth scraper. We're making that connection, and it just made him more confident in the situation, I think, altogether, because he was starting to take accountability for the things that were going on, and the fact that he was difficult. He was able to recognize those things. So I think that if we just try to understand where our patients are coming from, and understand that change is hard for
Hmm.
many people, but to just continue to have that conversation, and be scientific and present the things that we do know, I think the patients are more apt to be more understanding.
Yeah, and when you see something, say something. Like, he is very well aware. He's in an active state of disease, and we're going to do baby steps to help get him towards health. And I'm willing to work with him. Okay, he might not want to do the ideal treatment at this point in time, but what can we do to work together to get you towards that health?
Yeah, and we've all dealt with those difficult patients. But I think you're hitting on such a great point, that being confident, because we know our stuff, and being
Mm-hmm.
able to link the health and the oral together, patients are
Mm-hmm.
very impressed by that. I think they really appreciate that. And maybe, like you said, they don't realize sometimes that we're not just teeth scrapers. So,
Mm-hmm.
yeah, that's an excellent point. And speaking of, so how do you approach and educate patients about the oral systemic connection, and their overall health, like the link between perio and systemic disease.
Yeah, I think that's awesome. And really a lot of what we just talked about. So we explain, your oral health is your overall health and vice versa. There are 57 systemic diseases that are directly related to health. I mean, we throw stats out like, if you have periodontal disease for 10 years or more, you're 70 times more likely to develop Alzheimer's disease. Like, that's an outstanding stat. Biofilm starts to recolonize every 30 to 90 days. So we want to make sure that we're seeing you on a more regular basis so that we can disrupt that biofilm so it doesn't become pathogenic. When we really help our patients understand what happens in their mouth doesn't just stay in their mouth and it's really linked to their whole body, it makes a big difference, and they can see that other point of view.
Yeah, sure. So, what are some of the most common mistakes that you see patients make at home with their oral hygiene routine? And how do we address these issues, like during the appointment?
Yeah.
Mhm.
So a lot of the times patients think that if they're brushing twice a day for 2 minutes and they're rinsing their mouth out, then they're good. And unfortunately, that is just not the case. Like Laura was saying, we know that the bacteria recolonizes, in such a short window. And if they're only coming every 6 months, then we're dealing with a lot of biofilm buildup. And so we love to educate our patients through the disclosing gel that we utilize and show them where the bacteria is living and how long it's been there. And then through that, use, motivational techniques to get our patients on board with interproximal cleaning. So we love to recommend the water pick. We see such incredible results with our patients just from the chartings alone when patients begin to implement the water pick daily. Um, Obviously, also, proper brushing technique is really important. So making sure that they're brushing along the gum line and not just directly on the teeth, but that 45-degree angle towards the gum line. I feel like I'm a broken record most days when I'm cleaning teeth and educating my patients because it's a lot of the same conversations. And I think too, when we're able to relate to the home care, to the systemic,
Mhm.
and have that conversation, we're seeing this pathogenic purple bacteria. This bacteria is getting into your bloodstream, and you were talking this morning to me about this is, you're worried about Alzheimer's, and well, unfortunately you're not currently cleaning interproximally, so I think that a water pick would be incredible for you. That's going to be really important to make sure that this bacteria isn't getting through the blood brain barrier. And then their eyes just light up like, oh wow, I had no idea. And then it's just really important too, like I was saying, when we're having our patients and we're charting, and we want to celebrate the wins just as much as we're educating throughout all of this process. Even all the small little things, the lack of inflammation the next visit, or the decrease in the bleeding sites that we're seeing, the decrease in the pocketing numbers. I think it's important that we just continue to motivate our patients. Obviously, we don't want to berate and make them feel guilty or bad. We want to empower them and, celebrate along the way.
Yeah, I'd love that. And you know what I just started using and I'm loving it? It's called Slate. It is a
Oh, yes.
sonic flosser and it's just
Mhm.
amazing. I love it. So, what are some of the key preventative care protocols that you guys use in your practice? And how do you measure success of strategies to improve patient outcomes?
Oh, I love this. So really prioritizing those assessments, right? We really want to make sure that we have proper protocols in place, that our teams are using and implementing the same protocols, that the teams have similar verbiage, so it's across the board. And I mean, KPIs are important. I think that as hygienists, we need to embrace KPIs and understanding numbers and not be afraid of them. And then when we're talking with our patients, like Daniela just mentioned, really measuring the success of, hey, we're celebrating today because last time we saw you, you had 23 sites of bleeding throughout your mouth. Today, you're presenting with 8 sites of bleeding. That's amazing. Like, let's celebrate that win. So patients can see that difference and continue to motivate them towards health.
Yeah, absolutely. And I'd like to add to that too. Obviously, it's a continuum with our patients. It's
Mm-hmm.
not something that's going to happen overnight as far as the protocols and implementing all of these things and these new things with the patients sometimes. And sometimes there's such, we can utilize our tools in our toolbox, like salivary diagnostics, for one, is a really great way to measure, are we moving towards health? We can see it visually, but it's sometimes nice to actually do that salivary test for the patient to show them the decrease in that pathogenic bacteria because they want to know, like, is it working? Are we stable? Where are we? And so those kind of visualizations, I think, are also really great for patients, especially those periodontal patients, to know that we're stable, we're moving in the right direction, and all of their hard work is paying off just as much as ours.
Yeah, I love that.
And I'm so glad you brought up the KPIs because I do think as hygienists, sometimes numbers are intimidating. But
Mm-hmm.
I always say you have to measure so you can improve.
Yes.
Yeah, 1,000%. So Danielle and I, we had our a Diamond Study Club event last night where we presented our putting in prevention into practice CE, and after we presented, we were having this conversation with a couple of hygienists, and they were saying they felt stressed about having KPIs measured, and I challenged them to adjust their mindset around KPIs because numbers don't lie. And you want to know where there's room for improvement, right? We're all human, we all have room for growth. And if we can approach that growth mindset and look at it as a matter of fact, like, okay, you know what? I could improve here because this number is showing I have room for growth. Look at it that way and truly look at our patients as that individualized patient. Each, I know Danielle and I do this all the time. Each patient, how can I help them? What's the one thing that I can do for my patient to get healthier? And by doing that, that's going to automatically increase your KPIs.
Yep, I love it. Well, thank you so much for coming on the show today. I would love it if you could provide us some ways that our audience can get a hold of you if they have more questions, because you guys are just such a wealth of information. So,
Awesome.
how does my audience get a hold of you?
Yes, so multiple ways. You can get in touch with us via Instagram. We are at Diamond Girls Coaching. We are very responsive on there. You could always email us at ldiamantcoaching.
Hello,
Oh,
hello.
hello, excuse me. Hello at ldiamantcoaching.com. We also have our website, ldiamantcoaching.com as well. So there are multiple ways you can find us. We would be more than happy to talk to anybody to help you implement protocols, verbiage, help you gain confidence, whatever it is you're looking for. We are here to empower each and every one of you.
Thank you so much for coming on the DSO Hygienist podcast today. I really appreciate it.
Thank you so much, Christine. It's been an absolute pleasure.
Thank you for listening to the DSO Hygienist podcast. Please follow or subscribe to be alerted of new episodes.